present our case study. Okay, this is our case study. Miss Eve, 44 years old, was admitted into the hospital due to fracture of her left hip. During history taking, she informed that she was living a sedentary life, but she was once an athlete for spring. She also has history of amenorrhea, and her medical record stated that she has been hospitalized due to symptoms of porosis, lead retraction, thyroid acropathy, and plaques in the vertebral region. She has been methimazole and stopped taking it after the symptoms disappeared. Recently, Miss Eve complained of having severe back pain, and she also had early menopause. Okay, this is our learning difficulties. First, fracture of her left hip, live in a sedentary life, medical history of amenorrhea, chief complaint of having severe back pain, and early menopause. Okay, the diagnosis that we find from this case study is severe back pain related to postmenopausal osteoporosis. Okay, this is the case review. When women experience amenorrhea and eating disorder and osteoporosis together, this is called female athlete thyroid syndrome. Triad syndrome. Lack of eating causes amenorrhea and bone loss leading to osteopenia and progress to osteoporosis. Hyperthyroidism are suffered by Miss Eve. It can increase the number of bone remodeling cycles you go through. After 30 years, every cycle is inefficient. Women lost bone mass rather than building it, which increase risk for osteoporosis. Okay, the meaning of osteoporosis is osteo come from the word bone, and poros come from the word pore. Combination osteoporosis, progressive bone disease that is characterized by decrease in bone mass and density, which lead to increased risk of fracture. Okay, osteoporosis is a weak and brittle bone. So brittle, that means fall or even mild stress like bending and caulking can cause fracture. Okay, most common occur in hip, wrist, and spine. After both men and women, affect both men and women, but commonly in women because of past menopause. The women have the high risk. Okay, these are the risk factor consist of two: non-modifiable and modifiable. Non-modifiable, that means it come naturally, such as women, advanced age, postmenopause, genetic, early menopause, and small stature. The women have small stature, that's why it has high risk for osteoporosis. Okay, the modifiable risk factor is sedentary life, diet, alcohol intake, immobility, smoking, and anorexia. Okay, this is the pathophysiology for osteoporosis. Okay, when in this case, Miss Eve has postmenopausal osteoporosis. So the estrogen from Miss Eve's body decreases. It causes release of interleukin-1 and tumor necrosis factor alpha from blood monocyte. Then the osteoclast-mediated bone loss will increase, and 3/4 of parathyroid hormone secretion. The parathyroid hormone will secrete 3/4, and then it will divide into two. 3/4 of 1.25 dehydroxy vitamin D production, and the increase of renal production from the 3/4 of 1.25 dehydroxy vitamin D production. It will increase the calcium absorption by 3/4, and then the bone loss will increase. Okay, same goes for renal calcium excretion. Okay, the clinical manifestation, osteoporosis is known as silent disease. Okay, the symptom that mainly cause the person that have osteoporosis is back pain, loss of height over time, visible deformity such as kyphosis, a stoop posture, a bone fracture that occur more easily than accepted. Okay, next I proceed to my friend Atira.
Okay, now I will proceed to diagnostic tool. To diagnose osteoporosis, we can do these tests such as bone mineral density (BMD), dual energy X-ray absorptiometry or DEXA, history and physical examination, quantitative ultrasound. Okay, this is collaborative therapy to treat osteoporosis. The patient can change their lifestyle such as diet therapy, which is taking high intake of calcium and weight-bearing exercise. Second, they can consume drugs such as estrogen replacement therapy, calcium and vitamin D supplements, calcitonin and biphosphonates. Okay, then we proceed to surgical management. Surgery for spinal fracture. The first is vertebroplasty. The procedure is by injecting an acrylic compound into collapsed vertebra to stabilize weakened bone. Local anesthesia is injected into the vertebra. Small incision is made and a bone biopsy needle is inserted. Several small syringes of cementing material are injected through the needle into the vertebra. The cement hardens almost immediately. The next one is kyphoplasty. Several spinal compression fractures may lead to height loss, kyphosis and pain. To restore the height of vertebra and stabilize weakened bone, small incision is made and fluoroscope is used to guide the insertion of balloons catheter into the vertebra. The balloon is inflated slowly to raise the compressed vertebra and the deflated. Acrylic compound is injected into the vertebra and hardened immediately. Next, surgery for hip fracture. There are two main types of hip fracture, which are femoral neck fracture and intertrochanteric region fracture. For surgery for femoral neck fracture, the surgeon will use metal screw, which is implant metal screw to stabilize the bone while the fracture heals. Next is hemiarthroplasty, which is removing the femoral head and neck, then replace them with metal instrument. The last one is hip replacement. It is implant prosthesis after removing the upper part of femur and pelvic bone socket. For the intertrochanteric region fracture, the surgery is done by implant metal screw to keep the bone stable. Next is the surgery for wrist fracture. If simple fracture, cast and splint are already sufficient for the bone healing process. If there are more complex fractures, surgery will be required to fix the broken bone. The surgeon will immobilize the fractures with pins. Plates and screws are used to fix the position of the fracture. The external fixator is a device which involves inserting pins into the skin, an external device that pulls the bone into the correct position. Okay, next is nursing diagnosis. First, diagnosis is chronic pain related to osteoporosis as evidenced by pain score 8/10. Depending that can be used by the nurse, the client is able to act independently to reduce pain, and pain is reduced until it disappears. The intervention that can be done by the nurses is first assess the pain by question the location of the pain, the level of the pain, duration, frequency, and intensity of the pain. And the nurse can administer medication as prescribed by the physician. And clients can be encouraged to rest in bed and take a supine or oblique position that is comfortable for the patient. The nurse can give solid and not flexible mattress, give intermittent warm compresses, and massage the back or the side of patient that feeling pain. And then encourage good posture and body mechanics. Last one is teach client to perform relaxation technique of knee flexion. And the evaluation, client will feel more comfortable, and client's pain score reduced from 8 per 10 to 3 per 10. The second diagnosis that can be done is risk for impaired skin integrity related to immobilization as evidenced by client's condition. Planning, client will demonstrate skin integrity free of pressure ulcers. The intervention that can be done: first, assess the patient's skin daily correctness, warmth, and new pain sites. Then, encourage range of motion as simple passive range of motion exercise and weight-bearing mobility. Then, encourage the patient to perform as much self-care as her immobility and pain allow. Frequency of turning should be increased. If any reddened areas that appear, does not disappear within 1 hour after turning. Keep the bed as flat as possible to reduce shearing forces. Evaluation: no skin integrity detected at bony prominence area. In conclusion, as this type of osteoporosis, which is postmenopausal osteoporosis, is only happen to women, then women are encouraged to consume more calcium in their dietary intake and maintain proper body mechanics before they reach the age of 25 to avoid the risk of osteoporosis. For the Islamic perspective, Abu Hurairah narrates that the Prophet, peace be upon him, said, "There is no disease that Allah has created